So, hello everybody. Welcome to DayDreams podcast. Today I have a fantastic guest, Miss Mariel. Thank you for joining us. And I this is such a hot topic and such a big topic we're going to be talking about tonight. So I do want to tread lightly here, because it's very sensitive topic, but most people feel the direct impacts of higher home costs, higher rent prices. But what happens when you can't really afford those costs anymore? And so the homelessness crisis has been constantly growing each and every year. And so today I have a subject matter expert on who's agreed to come on the show and give us a little bit more details about what's happening, particularly in the Georgia climate right now, but as we expand to the larger America, how that impacts each and every one of us. So, Miss Mariel, can you just tell us a little bit about yourself and take it away?
Yeah, sure. Okay, well, it's a pleasure to be here with you. And I'm a great friend of your dear mom. So I'm excited for her to listen to this. And she's become a really close friend of mine over the past couple years. And my work is in housing. I started my career as an attorney. My first job out of law school was working with people who did not have housing. I worked at a small legal clinic called the Georgia Law Center for the Homeless. And everyone that I worked with met that HUD definition of homelessness, which meant that they were in a domestic violence shelter or some other kind of shelter, or they were living on the streets. And that was an interesting, eye-opening beginning to my career. And I was really young when I was doing that, and I was fearless. And if I could go back, I would change a lot about how I worked because when you're a little bit older, you see things differently. But it was a great way to start my career because I was doing direct client work and really seeing people and meeting them where they are and trying to help them as best as I could through different systems. So fast forward a little bit further, and I did some other types of law, and I worked for a short term at the Long-Term Care Ombudsman's Program, which is an interesting program that's federally funded that visits people who are in nursing homes, assisted living, group homes, and checks on them and advocates for them. So I did that for a short time. And then fast forward a little bit further, and I took a role doing education and advocacy for supportive housing in Georgia. At a time where it was very limited, there were only a couple places that were doing supportive housing. This was 2016, and they were and still are the foremost leaders of supportive housing in Georgia. But we've seen nationally kind of an understanding of what supportive housing is. And so it has been interesting to see how supportive housing has progressed, but also had to really fight to exist in some other ways as well. And now I work for a wonderful nonprofit, and we are creating affordable rental housing and also transitional programs and a little bit of supportive housing. And so I have kind of a wide breadth of housing experience, and I'm happy to talk with you about it.
Gotcha. And thank you for that broad overview. Now, I did want to back up a little bit because you've had like a vast, expansive amount of experience here. So, really, can you walk us through what it was like back then and what it's like now? Has it gotten worse? Has it gotten better? What is the stigma like with housing? Or are we having issues funding? I know that's kind of a loaded question, but could you kind of take us through like what's evolved a little bit here?
Yes. So many people will disagree with me about this, but in the state of Georgia, I think it has gotten better in terms of services for the unhoused. And it has gotten harder for people who are traditionally in unsubsidized rental housing. So when I started my career, um, people were warehoused in shelters. It was bunk beds, it was community showers, it was very unhealthy meals where people would line up for, red drinks, orange drinks, yellow drinks. It was very difficult emotionally, physically, every single way, particularly in the all male shelters where there was a lot of violence. Um, some of those places still exist, some of them have been remodeled, but generally, we have seen a trend in homelessness services to individualize services so that people have their space and there's more dignity involved. And so there's a lot less warehousing. Also, there's an understanding that has come actually from the Supreme Court of how to treat people with mental health backgrounds or disabilities. Actually, Atlanta Legal Aid prosecuted a case, a civil case, all the way up to the Supreme Court of the United States. It's known as the Olmsted case. And what the Supreme Court decided is that people who have mental health issues, if it's not too much of a burden on the community, they should be living in the community. And I think Chad Jones might have talked about this in your podcast with him, and he was a great guest. I listened to that. But after that Supreme Court case, Georgia had to take some good actions to get people out of mental health institutions and into their own homes in the community with supportive services. So I think we've seen two trends in that regard for the unhoused that have been really, really popular. And also, as I mentioned earlier, there's a better understanding now about supportive housing. And what that is affordable housing. So deeply, deeply affordable because the people who usually access it have no income or they're on SSI or SSDI. And it provides them with the supportive services that they need to live in the community. So, but for those supportive services, they probably wouldn't be able to successfully live in an apartment.
Right.
So we have seen an understanding of what that is. And until recently, HUD was really prioritizing creating supportive housing. And I think that's helped a lot of people. On the flip side of that, it's very expensive and it takes a lot of thought. And ideally, when you have more supportive housing in the community, you're taking money away from those crisis services because you're not paying for the emergency room. You're not paying for the justice system. You're not paying for the mental health institution. You're not paying for, the sheriff's department. You're supposed to be moving those allocations into the supportive housing system. So all of these different parties have to be aligned. And so sometimes it works well and sometimes it's misaligned.
That's it's funny that you bring that up because Chad Jones, when he was on the podcast last time, he was talking about that, and we brought up the question, why should taxpayers, we as taxpayers, support this kind of initiative, and why would we want to home or pay for affordable housing for someone that's unhoused or homeless? And that raises a big question, and it is kind of a controversial question when you bring that up, but the way he explained it is you can take away money from one end of, I think the analogy he gave was like a blow up balloon, one of the party balloons, where like if you squeeze it, all you're doing is taking away from one aspect, whether that's that funding for the homelessness or funding for affordable housing or supportive housing. What you're doing is just taking that away, but what you're doing is now allocating that to the increased cost that these individuals now have to go through the police system, they have to go through the court system, they have to go through the hospital system to get all these things checked, whereas we could stop that at the core of it and actually reduce the amount of money taxpayers pay, which I thought that was phenomenal. I'm like, well, why
Yeah,
isn't everybody on board with this?
I think he explained that very, very well. And there's also just an ethical perspective to it. We're called to serve those in need. We're called to house the unhoused. We're called to serve the orphans and the widows. And if you don't provide people with what they need, you see what we see in the annual point in time count, which is done throughout the country in January. HUD requests that teams go out in the middle of the night to just source who's out there, who's unhoused, who can you find in the
Right.
community and do a count. And it's not an accurate count, but year after year you can sort of see some trends. And so if you ever question the utility of providing these types of services, just volunteer 1 January to go out and do a point in time count. And I guarantee it will move you to understand the services.
Yeah,
Because
that's a sorry, go ahead.
oh, I was just gonna say, you see people living in bushes. You see, women with, a really thin blanket hiding in shrubbery. It's just devastating. You see young men mostly at MARTA stations, trying to get into the train station. It's just a devastating thing.
Yeah, I don't think that's a perspective that a lot of people have. Like a lot of people that like to criticize these programs, criticize them behind a screen, and don't really go out and volunteer first before you start criticizing them. Because, in my opinion, you really don't have room to speak unless you've actually worked on the issue itself. Like, you can't tell a nurse how to do their job unless you're a nurse, right? So, I mean, it would be very beneficial for somebody that's a taxpayer who's complaining about these services to get out there and actually do the work so you can see exactly what you're doing, exactly how you're helping. But half the time, I don't see people that are complaining doing that. They're not getting out and actually going to help or volunteer their time. And you're right, that's what we're kind of called to do. And you know, my mother.
Yeah.
we're very deeply religious people. And so I mean that is a spiritual calling. That's not just, you know, a personal calling or an ethical calling. That's a spiritual calling that we find ourselves in. And it's really it's very strange that the individuals that claim to be the spiritual ones are not the ones that are supporting these actions to support their brothers and sisters on the street that are suffering, you know, through the cold, harsh winter. I mean, like it was like I remember just a couple of weeks ago, and my wife had this brilliant idea. I mean, if there's not much that you think you can do, there is plenty that you can do. And my wife had this brilliant idea. Well, she's like, I know that there's going to be this ice storm coming up. I'm going to buy a bunch of thermal blankets. And so she bought a bunch of thermal blankets and she just stuffed them in our car. And she was like, anytime we see somebody in need that needs it, let's just give them a thermal blanket. And it's just as simple as that because you might not think you're making an impact, but that thermal blanket could save someone's life. When it got down in Georgia during that ice storm to what, 16 degrees at one point, like, I mean, maybe that's nothing for the north, but for us Georgians here, that's cold.
Yeah,
So
it's cold.
yeah, I mean, and I was so proud of my wife for doing that. And she was like, yeah, that, you know, we should be helping people in that sense, even if it's something small, you know, as small as giving like a blanket or as small as giving, you know, food or something. I know everybody has their own opinion about that, but I strongly believe like if you're going to criticize the system, at least do something. You
Yeah.
know, you can't criticize and do nothing.
A lot of the people who find themselves in those situations have come from a really traumatic place. I mean, it's not an everyday occurrence that you find someone with these levels of
Right.
that lead to these things. But then over the past couple of years, we have seen, as you mentioned at the outset of this podcast recording, rents have gotten very high. The situation is very sensitive to a lot of people because it has affected more people in the past couple of years. And we can speak about kind of how that happened during the pandemic when rents really started to rise. But so we have people who have, you know, been chronically homeless, who have a deep level of need and trauma and a deep level of services. And then we have a lot of family homelessness. We have a lot of people who are entering homelessness for the first time ever. We have more people entering that gap of homelessness than exiting, actually. And their numbers are not being recorded because they are not going to shelters and they're hanging out on people's couches. There's families doubled up together. They're staying in their cars. A lot of people, unfortunately, are staying in their what is it called? Where you put your property in storage. Their storage units. We've seen a lot of that recently. That's happening, and they're still sending their kids to school for the most part. That's where they're getting meals. Um, a lot of times their homelessness is completely hidden because they're terrified of losing their kids to defects. So that system is overspent now too. The defect system has exceeded its budget because it has this vast need, and a lot of the interventions that defects uses are very expensive. And
Right.
so it's an underfunded system that has a long way to go to be preventative because it's very expensive as it is to not be preventative, but just to, take the cases that it does come into contact with. So if everyone who needed housing assistance were to go to defects preventatively, it would just be flooded. It really would be.
And it's so sad because a lot of times the one criticism I hear a lot of people saying is, well, they did this to themselves. You know what? They're homeless because they made bad choices. They did drugs. And that's like such a stigmatism that I hear people talking about. And it might be true of very small portions of the population, but for the vast majority of the population, that do end up in these situations, I mean, you said it before, it's these traumatic events that happen. It's a mental health issue that's tied up into it. And now we're seeing higher rent costs and higher home prices on top of that. So people are not just also losing their homes because of these mental health issues. That was the broader case. Now it's also because people just can't simply afford it anymore. And could you talk about a little bit about the tie between mental health and homelessness?
Yeah, absolutely. So there have been some good studies lately that show that homelessness is increased in areas where there is expensive housing, where there has been, a lot of development and such. Um, and so that's deeply tied with the housing crisis because, we all know people who drink and do drugs and they're housed. They're working alcoholics and such, and it doesn't lead to their homelessness. It's usually for someone to lose their housing. They don't have that safety network of family, friends, etc., who have resources. If you come from a network of family that never had resources to begin with, when you fall into that homelessness cycle, you don't have anyone to latch onto. So, someone going through a divorce who has family resources is not likely to fall into homelessness. But someone going through a divorce who doesn't have a mom or a dad or a sister to go, and support during that difficult time when their family situation is different, they're much more likely to end up homeless. And so once you become homeless, it's really hard to just get a leg up and get out of it. And that's why we've seen a lot of people end up in extended stay motels because they don't have the family resources to be able to go to a family or friend, or they have and they have exceeded their time in that place. I once saw a TED talk by a fellow who ended up homeless in a shelter, and he had been with a lot of family and friends before that. And he said, "I'm pretty fun, I'm pretty cute, and I ended up homeless. Imagine how quickly you would end up homeless." And it was really striking to hear him say that. So, I mean, chronic homelessness, yes, there's a deeper tie to substance abuse, physical disabilities, age, um, youth exiting out of foster care, and veterans. There are definite linkages there. But family homelessness is largely a matter of systemic issues. And we have this gap in living wages now that just gets deeper and deeper. And we saw during the pandemic about how many people lost their frontline jobs and how many people continued to do their frontline jobs when it was dangerous to do so, or when we perceived it to be dangerous to do so.
Right.
That's been an interesting thing as well. The wealthy are very, very wealthy. We're losing our middle class in a lot of respects. It will be interesting to see what happens with continued change that's wrought by AI and other systemic changes. And so the disparity between the haves and the have nots continues to expand.
Well, what is your take on that? Because I think the recent jobs report just came out. It was 92,000 jobs lost, and I'm sure the official number is actually higher than that. But in sectors where we thought were safe, like healthcare, we're losing a lot of jobs. And so what is your take on, what's to come in the next 5 or 6, 10 years? You did mention AI kind of displacing some jobs. What is your take on all this? And do we expect to see higher prices in rent? Um, and what can be done about it, honestly?
Yeah, it's really impacted housing policy. So during the pandemic, we saw, more people housed who were unhoused than ever before. People were given motels, there was a moratorium on rent payments, more people were housed. But at the same time, we found nationwide a shortage of rental housing and particularly affordable rental housing. And we saw people who could afford to rent more expensive units living in affordable units because they could. And so even though they could have met the barriers to get into maybe luxury units, they weren't choosing to do that. And so that was making those affordable units scarce for the people who couldn't afford the luxury units. And so they were going down to more substandard apartments and such. And then at the same time, it was a time of renovation. It was a time when people were doing things. And so we saw a lot of renovation of homes, and people lost their naturally occurring affordable housing when their landlord decided to raise the rent because it had been renovated. And we saw just on a grand scale, large developments that had been kept affordable for 15 or 30 years, their affordability periods were ending around that time. And so they were redeveloped to be luxury because it might have been too expensive to keep them affordable to do those renovations, or
Mhm.
the owners, developers just decided we need this money, we need this cash, this is a great opportunity for us. So we saw, soon after the pandemic, many evictions that were not allowed to be filed during the pandemic, just an excessive number of evictions. And then those folks have this, letter on their housing history and they have poor credit. And so a lot of them ended up what we call the hidden homeless that I was mentioned before, who are staying with friends, staying in their cars, oftentimes staying in motels. So policy wise, and this is an indirect way to answer your question, policy wise, cities, municipalities, HUD nationwide has emphasized creating more housing units because the way to get out of that scarcity is to develop more. And so we're running into situations where local cities, they like having big houses because you can get more property taxes for them. But we really need more smaller homes so we can build more, so that they can be more affordable, so that more people can be housed. So this is a nationwide conversation that I think affects everybody. It affects the grandparents who are looking to downsize, the new young people who are looking for their first home. It affects the people who used to be in affordable housing who are no longer able to be housed because it's just not out there for them. We've also seen an increase in barriers to getting into housing. More and more landlords are sophisticated after the pandemic. They run credits, they run background reports. The mom and pop landlord that will charge you $850 and trust you that you're good for your word is just not to be found anymore. It's just a higher barrier system. So as wages change and such, the way to dig us out of that is to go back to, I guess, policy that was implemented around World War II, where we build houses for people and we develop houses for people. And that can be very creative. It can be small homes, tiny homes, manufactured homes, ADUs. Cities are going to have to get creative about building materials and allowing for different zoning to allow for these different things because the nuclear family um, is not going to be buying up all these big giant houses.
Yeah.
We're seeing more singles, we're seeing more people living alone.
Well, I think that raises two questions for me because I'm in agreement that I th one of the solutions is build more affordable housing. But I think the one question that I have that relates to why a lot of the housing prices, particularly in the Atlanta area, shot up so significantly was because of this supply and demand. And I think that that initial reaction, build to help increase supply, drive down the price. The issue that I saw wasn't that bunch of families were buying the properties. It was a bunch of investment properties, investment companies, corporations that were buying the properties. It was, I, I think the last statistic that I saw was back in like 2024, 2023, where it was a third, like a large percentage of the single home family homes in the Atlanta metro area were being bought up by these larger corporations to artificially increase the housing price. And so they looked at these as investment properties. And so that's if we build a bunch of these houses and create these affordable houses, how are we going to stop these corporations from buying them up and doing the exact same thing? Like that is the major question to me because that is a problem.
Yeah, it has been a problem. It really has been a problem. And it's largely a byproduct of the recession. So back when, we had that recession, I guess it was about like 2005 or 2006 to maybe 2010 or so. Don't quote me on when that was. A lot of the developers went out of business. The small developers were crushed. It was a very sad time for housing developers, and a lot of things that they had put their time, investment, and fortunes into went bankrupt. And so the very large corporations. Some of them were bailed out nationally, and others were just large enough not to fail. Some of them were deemed too big to fail. They were able to capitalize, literally capitalize on all of these misfortunes and smaller developments. And we still see this. We still see that these large corporations are able to come in and really buy. There is some movement nationally and in Georgia to put some limits on that. There are some bills at the legislature right now that are seeking to do that. I think last year a bill was passed that you had to have someone on staff locally, to serve as a property manager. This year, the legislators are going in a lot more aggressively with ways to tamp down on these corporate ownerships from out of state and to do things. We had crossover day on Friday, and Sine Die, which is the last day of this session, is coming up in early April. And the legislators have a choice. They can decide what they want to do in this respect. We live in a capitalist country. We live in a market-driven country, and I personally respect that. But it is our legislators' role to protect health and safety. And so, if it gets to a point where the community is mismanaged to the point of health violations, code violations, crime, then legislators need to step in and reclaim that. Um, it's good to make money on investments and to make smart deals and such like that, but we need to protect the people who are living in these commodities because one person's commodity is another person's home. And so the legislators are trying to find a pathway forward, finding a balance in that. And that's a difficult thing to do when it has gotten to this point where we have so many corporate owners. But I believe Georgia has more corporate owners than any other state. I believe that's the case. So I also believe we have more motels per capita in Gwinnett County than in any other place in the country. So that is something that we as a state need to reckon with and deal with in a very smart, thoughtful way for long-term planning and long-term outcomes.
I completely agree with you. I think that it's the legislator's job to, I mean, to protect the people. I mean, that's literally their job.
Mm,
I couldn't have said that better myself. But going back to the other reason or the other question that I have is if we build these affordable homes and add to the supply, where do we build them? Because the last thing you want to do in an area is to almost gentrify it and indirectly increase the cost of living in that area. So how do we do that? And how do we do that? Like what is
yeah,
Mariel's suggestion for how we do that?
actually, it goes back to policymakers again because they have the ability to put in time restrictions for how long something needs to be affordable and how deeply affordable it needs to be. So we saw this happen with the Beltline, where you could do affordable housing or you could pay a penalty for not doing affordable housing, and things like that can be implemented. One of the one of the best practices is the low income housing tax credit developments where you have to keep those units. You're getting tax credits with the promise that you're going to keep those units affordable for 30 years. And so you could put them in Grant Park, you could put them on the Beltline, you could put them in City of Atlanta, you can put them in Dahlonega, you can put them in Cumming, wherever they are. It can gentrify all around them, but those units stay affordable,
So
which is
how do they stay affordable?
so it's a very competitive process and it's a really smartly designed process. It's actually, interestingly enough, it's an IRS program. People think it's a HUD program, but it's actually an IRS program. And the way it works is that federally we get federal tax credits and they're sold in a syndication market so that companies that pay taxes can buy these tax credits so that they purchase the tax credit and then it reduces their tax obligation. And then the money that they use to buy those tax credits, the developer or a nonprofit can use to make affordable units. So it's
Uh,
very cool. And in the state of Georgia, we actually have a match, which is a wonderful thing that our state legislature has done. We have a match of the federal tax credit with state. taxpayer dollars. And this is, to my understanding, the only money that Georgia gives for the development and the rehabilitation of affordable housing in the state of Georgia. And what I mean by affordable housing is that it is subsidized. So it's subsidized by these tax credits. And so the people moving into it need to be under a certain income level. And that's how it's subsidized, is because of this equity that's being put into it by this partnership. So it's a very clever mix of private funding and public funding. And it's braided together. And so the nonprofit can purchase land or have land donated. And then they work through our local Department of Community Affairs to apply for these tax credits. And they say, I'm going to renovate these units to keep them affordable for the next 30 years. Or I'm going to start new and I'm going to develop a brand new apartment building. And it's going to serve 100 people. And 50% of it will be affordable for 30 years. And then they tell the Department of Community Affairs, I'm going to keep this these units, the set aside at 30%, 60%, 80% of area median income. And then they have to do that. And so they're making a promise by receiving this money to keep it affordable. And then HUD sets the standard of what affordability is for that area.
But they're also setting requirements for the people that that the people that are in these homes need to meet as well.
So that's a really good question. So there's two aspects of that. So yes, they have to be under a certain income to be able to qualify for the 30%, the 60%, the 80% income levels. So they can't make, $500,000 a year and try to get into this subsidized unit that's $1,200 a month. They're not going to be able to qualify for it. But it's interesting you asked that because these properties are largely managed by private companies. And so there are entry barriers to getting into low income housing tax credit properties. There are. They'll look at your criminal background, they'll look at your housing background, and you have to qualify because they still have operating expenses. They still need to collect that rent. They still need to provide a safe environment. And so it's not the same as what we saw maybe 20, 25 years ago, where it was a Section 8 property where everyone living there was paying 30% of their income. And there was a pretty standard application process, and you could appeal if you didn't get in. You could have an administrative law judge make a decision as to whether you should be admitted or not based on independent, individualized assessment. They don't do that anymore. With these tax credit properties, um, if you're going into a unit that's going to be 80% of the AMI, that unit might be 1,100 a month, and they want to see that you make two times the rent so that you can afford to live there. So it is a little bit harder to get into these units. On the flip side of that, they're beautiful units. No one knows they're subsidized. They blend in beautifully with the community. They can be catalytic to the neighborhood. They can create a lot of positive investment, and it creates units for people who cannot afford market rent. So it's without federal subsidy, you really can't support people who can only pay 30% of their income towards rent. And so tax credit properties are the one way that I know how to do that right now. I don't know any other way to do it.
Yeah, and so you mentioned that you have to be under a certain income level. So I know that we had talked about this, kind of off podcast. So what incentivizes people to then increase their income and move out of these affordable housing to like maybe a different property so someone else can come in? So like what's the incentive there? Because I know you and I talked about it and it kind of evolved over time where there was an incentive to kind of stay below this level, but now you mentioned or hinted at that there is an incentive to kind of move out. And
Yeah, there is now.
okay,
Yeah. So there's no incentive under these low income housing tax credit properties to make a bare minimum, to stay under what's called, I think it's called the benefits cliff. Where if I make too much, I'm going to lose these benefits. Under these tax credit properties, if you're making enough to qualify for a 60% AMI unit, if you make more money, it's good for you. You'll probably still pay the same amount of rent, but it's not necessarily going to bump you up so that you have to start paying 80% of the AMI because that's a big income change between 60 and 80%. So you're not going to fall off the benefits cliff. So it's generally not a problem at all. Where we have seen that in the past is where your income is based on your housing is based on having a very, very low income, basically 30% of area median income or less. And any increase that you get could potentially cause you to lose TANF or lose your SNAP or lose your child care benefits or lose your Medicaid. And so under this housing with low income housing tax credit, it's not the same problem. It's not the same benefits cliff. You have an incentive to actually make more money. And the people who are living at 30% based on income, they're generally in supportive housing because they're disabled. They're generally getting SSI. And so their income is not going to increase, generally speaking. If they're at 0 to 30% of AMI, they need that SNAP. They need that child care. They need that Medicaid. Um, so it's generally that situation.
Gotcha. And so is there a transition period in which we move people off, or like is there a limit to how long someone can live in affordable housing and before they're like rotated out and expected to kind of have a higher level of income? Can you walk us through that?
Yeah, sure. So, okay, and I should clarify, there's a difference between properties that are based on income and they take 30% of your income towards rent, and
Gotcha.
properties that are based on area median income where you qualify because you don't make too much and you're able to pay the rent
Gotcha.
on 30, 60, 80, 90, 100% of.
Yeah, I was under the assumption that the 30% was how it used to be, and I'm thankful that you made that distinction.
Yes, and that's exactly how it is. So it's pretty rare to find a property that's based on income anymore, where you just pay 30% of your rent. That's pretty rare. And where we generally see that supportive housing, which is where people have some kind of, you know, need for supportive services to be able to live in the community. That's generally where we see it. There are a couple grandfathered communities that are out there that are based on income. They're largely for seniors. Very rare to find a family community that's like that anymore. There's a nationwide program, the Housing Voucher Program, which is based on income, and that's where if you have a tenant-based housing voucher, it's called a Housing Choice Voucher or a mainstream voucher, you pay 30% of your income, and the housing authority pays the rest of it.
Hmm.
So that's a nationwide program. Currently, as long as you are doing your due diligence for your voucher, you're able to keep that voucher as long as you need it. There's been some talk nationally about canceling that, changing that, upending it. I personally think that's problematic because if someone's using that voucher to pay for their housing and they're working in fast food or service job, their wages are not going to change and make them immediately able to afford market rent. I mean, those vouchers, those tenant-based vouchers exist because we have different wages across the country. And in order to live in Roswell or to live in Alpharetta or to live in Savannah, you might need a voucher to go to your job every day. People with disabilities, they have that based on income. That's why they have that voucher. So that's a national conversation right now. But it's pretty rare to have housing developed in 2026 that's based on income. It's
Gotcha.
pretty rare.
Yeah, because you know my mom, and I know you know her situation. She'd be fine with me talking about it right now. But essentially, the issue that she's going through, just for people that are listening, is Social Security and Social Security income. And she's, mom, sorry if I butcher this. You're 65, right? So, she, you know, she had a heart attack a couple of years ago, and technically should qualify for disability, but there are some issues where I can't get into too much detail right now because it would take the rest of the podcast to kind of explain. But one of the issues that she has been facing with Social Security income is that, being at her age that she's at and having, several heart attacks, you can't just go back to work to make more money, especially, this late in life. And so one of the issues that she's finding herself at is that she can't make over a certain amount of income for Social Security, or else she starts to have to repay it back, and I think it's
Yeah.
what is it, a dollar for every $2 that you have to repay back. And so you touched on this, and it's this benefits cliff where if you're not working full time, well, then you're kind of in this weird zone to where she can't really afford to go live entirely off Social Security because the cost of living has gotten so high, like groceries, gas, property taxes. Her house is paid off. Property taxes, that's a big one that constantly increases. And she still needs to pay these bills, but she can't just live off of Social Security because it's just not enough. So what she ends up having to do is she has to go work. And so she's a boots on the ground kind of person. She's out working on her feet all day, every day, 65 years old. You're going to kill me if I, if I call you 65. You're not 65 yet. Um, she'll be 65 this year. Sorry, 65 this year. Uh, but boots on the ground, 65 years old, has had 2 heart attacks in the last 5 years. Like, make that make sense where you're going to tell this woman to go just get a full-time job and work more. It's
Yeah.
it's not possible. So she's at this weird level where she has to keep her income under a certain amount on purpose because if she goes over it, they've set the poverty line for the amount that you can make for that social security amount so low that
Yeah.
it doesn't really match the cost of living today in 2026 where the price of everything has gone higher. I mean, really, she argues to me that the property line or the amount that you should be able to make shouldn't be so low anymore. It should be a little higher. So that way you can meet your basic needs, and you can work. And my mom is not someone that's just willing to live off Social Security benefits. Anyway, she wants to go out and work, and she wants to give back to the community. She keeps saying to me all the time, "If I can work, I'm going to work." So totally admire her for that. But it doesn't make any sense logistically, politically, policy. It doesn't make any sense why it is the way that it is. And that's kind of the issue I was trying to understand. Do we have that same issue? And it doesn't sound like we do in
Well,
those housing
we
spaces.
do. We do, though. I mean, we definitely need properties that are based on income. We absolutely need them, especially in the senior space. We need properties that are based on income because you can, be a senior who's getting $900 a month, and that's too little for a property that's based on 30% of AMI, which could be 1,200 a month, for that area of town. So we need properties that are based on income. We need these tenant-based vouchers. They're not an entitlement in our country. A fraction of the people who would qualify for them have them. So they're pretty much like gold if you can get them, these tenant-based vouchers. We absolutely need them. And then in terms of our senior housing, we have not cultivated affordable senior housing or housing for people with intellectual and developmental disabilities in this country. We haven't done that. And so we have a tremendous number of people at risk of institutionalization. And nursing homes are subsidized. You can be on Medicaid, and Medicaid can pay for a nursing home. But assisted living, where it's, a nice place to live and a lower level of supportive services, is not subsidized. That for 95% of our country is private pay. So that is an issue just right there that we're forcing people who have vulnerabilities to choose an institution like a nursing home or a mental health institution in some situations because we don't have community-based services that are affordable for them. And so we're seeing more and more people with intellectual and developmental disabilities who are living with their aging parents and do not have a safety plan for what's next when their aged parent is no longer able to care for them. And they don't need to be in nursing homes, but there's not a plan for them to go into assisted living because it's private pay and maybe they're on SSI. And, the group homes are very difficult to navigate. I mentioned that I worked at the Long-Term Care Ombudsman's program. There are licensed personal care homes, and then there are unlicensed ones. And you really need people visiting and checking on these folks all the time. And so this is a nationwide problem that we have. And that 30% of income is strategic. One of our Congress people came up with it in the 70s. It was 25%, I think, in the early 70s. And then in the 80s, it was raised to 30% because it's specifically for people with very little income, that they can only afford 30% of their income on their housing because they have so little income. If you're making 250K a year, you can pay 80% of your income on your rent and you're going to be fine. So this based on income equation is critical. And, property has become more expensive to develop. And so it's harder and harder to do that. And the housing authorities are our vehicle, our mechanism for creating these vouchers, the tenant-based vouchers. And when I say tenant-based, I mean you give a person a voucher and then they go find a landlord. Or project-based, which means you develop apartments or rental units and that subsidy goes with the unit. They're critical. And we definitely need properties that are based on income. We certainly do. There's a trend towards creating mixed incomes, and Atlanta actually, I think, started that trend. The Atlanta Housing Authority started that trend um, for socioeconomic diversity, so people get to mix in with people and see different things and have better outcomes. And so I think that's a piece of this too, is creating varying levels of affordability in nice, diverse areas. And so if you're doing 30% of your income, it's not congregate. It's not everybody in one institution. It's not everybody in one neighborhood. It's less cost effective to make it scattered site. But we need to have a mix of congregate and scattered.
Yes, ma'am. Well, thank you, Miss Mariel. This has been a fantastic conversation. Any last thoughts before we wrap up here?
No, I appreciate your listening to me so thoughtfully. And your mom was actually texting me. So
Was
I
she?
I was seeing her text messages, and I love her very much. And it was a pleasure to get to know you better through this podcast and listening to your prior podcast as well.
Yes, ma'am. Well, thank you, everybody, and thank you for listening in to Daydreams. It has been a wonderful evening. Have a great evening. Bye bye.
Thank you. Good night.